Dr. Regina Koepp is a board certified clinical psychologist, gerontologist. She's former assistant professor at Emory University School of Medicine's Department of Psychiatry and Behavioral Sciences. She's assistant professor there, or she was at least, and then she was formerly a staff psychologist at the Atlanta VA Health Center, healthcare system, where more than a decade she provided direct patient care and consultation in the geropsychiatry outpatient mental health team. Dr. Koepp recently stepped down from her roles at Emory and the VA to become founder and CEO of Gero Champions, a company that provides training and education to enhance the mental health and wellness of older adults and their families. Dr. Koepp is a national leader in the mental health care of older adults and has served on several national, regional, and healthcare communities dedicated to destigmatizing mental health for older adults and improving access to care. Dr. Koepp is creator and host of the Psychology of Aging podcast, where she discusses mental health and aging. She's been featured in the Chicago Tribune, Baltimore Sun, Insider, and is a contributing writer at Psychology Today. She has a website. She's going to offer for us some free resources. I'm thrilled to have her with us. And Dr. Koepp, if you would like to share your screen and give us some vital information, we really appreciate you being with us. I know you're here somewhere. I don't see you.
Yes. Yeah. Hi. Thanks for having me. I'm so delighted to be here. I also want to say, as a former provider to mental health services to veterans, how touching and important the VEO is. One of my dear friends is actually the director of the homeless program at the VA. She's a psychologist as well, but relevant to older adults because 1 of 2 veterans are 65 and older. And so, and not necessarily veterans receiving care at the VA, but all veterans nationally, 1 out of 2 are 65 and older. And so that's 50% of veterans are 65 and older. So relevant to this group here. So thank you so much for having me. I'm going to share my screen. I have one audio clip that I have practiced earlier and it worked. So I'm hoping that it will do the same for me today. But so thank you so much for having me. Today, I'm going to be talking about older adults and resilience in the face of ageism and COVID-19. Can you all hear me okay? John, yes. I can see you well. So if you just nod or give me feedback throughout the meeting. Okay, great.
And the rest of you, make sure if you're not already, make sure you're muted. So if there's any background noise, it doesn't interfere. Go ahead.
Okay, great. So in this webinar, I'm going to discuss 2 public health crises affecting older adults, ageism and COVID-19. And I'm going to describe how COVID is affecting the mental health of older adults. I'll also talk about how ageism is affecting the mental health of older adults and share 5 resilience strategies that research shows older adults using to get through the pandemic. So stay with me until the end because I'll tell you how you can get your hands on this bonus, which is the 5 must-know facts when working with older adults. It dispels myths about older adults and families. So as we get started, I'll ask you to turn off all distractions. And I'll just say, I suspect that you are here because you're dedicated to helping older adults live their best lives in whatever role you have in working with older adults and their families. You're curious maybe about how the pandemic has affected the mental health of older adults. We've heard a lot in the news over the year about older adults and the pandemic. And perhaps you want strategies for helping older adults thrive during one of the most difficult times in history, disproportionately affecting older adults. I want to back up and say thank you so much for being here and the work that you do in working with older adults and their families. You have a really important role in helping older adults during this current crisis. So thank you. We all have an important role to play. And I'm certain, at assisted living communities, other housing authorities, other senior authorities. I saw a few people I recognize here. So thank you so much for all of the work that you're doing and how exciting about the VEO during the pandemic as well. So thank you, John, for that reveal. So where are we going? Today I'm going to talk about ageism. I'm going to define it. Maybe some of you know what it is, maybe some of you don't, and the toll of ageism. I am going to be, let's see, I'm trying to get, okay, good, I can see John. I'm going to talk about what you can do to correct your ageist beliefs, and don't worry, we all have them. I'm going to talk about COVID-19 and older adults, how the pandemic is affecting the mental health of older adults, and 5 resilience strategies that older adults are using to get through it, how to work with me, and then a live Q&A at the end. All right, so I'm going to ask you to type in the chat box what you see. What do you see? Let me see how I can find my chat box. Found it. Okay, got it. What do you see? Some people say a duck, a bird, a rabbit and a duck profile, a bird, a duck, bird, duck, duck. So I saw one rabbit, rabbit, duck. Somebody saw both. 2 people saw both. A bunny and a bird, a duck. Right. My hope with this presentation is, well, one, so here is the bird. So this is the beak and the eye of the bird. And then if you look at the opposite profile, you see the bunny face, eye, and the bunny ears here. Can you all see them now? The bunny and the duck?
Yeah.
Excellent. My hope with this presentation is that it will broaden your perspective and what you see when you think of older adults, so that you don't get stuck only seeing the duck, that you have a broader view and can see the bunny as well. So now what do you see? An aging dishwasher or an activist? This is rhetorical. Well, let's find out. Oops. So this is where I'm hoping the sound works.
Was diagnosed 7 years ago at the age of 59.
Could you hear that? Okay, good. Let me pull it somewhere else to hear from the beginning.
Facility in exchange for some time with her husband. We reached Mary Daniel in Jacksonville. Thanks so much for being with us.
Thank you so much.
Could you tell us first a little bit about Steve?
Steve was diagnosed 7 years ago at the age of 59. He was a career salesman. So he traveled quite a bit, sold orange juice out of Florida, and just really full of life and enjoyed being with other people.
What was it like going from daily visits to not knowing when you might ever get to see him again?
It's been devastating. I went every night after work to get him ready for bed. We'd lay into bed and just hold hands and watch television as he would literally drift off to sleep. And it was really our routine. It was a real great way for us to connect every single day. And for him just to end every day on that peaceful note. And I did that on March the 10th, and they called me on March 11th, and they said, you can't come back.
And could Steve understand that?
Has absolutely no understanding of it at all. All he knows is that I am gone. We did do 2 window visits, incredibly painful. He cried both times.
Oh my God.
And on Father's Day, that was our last one. I decided that I'm not going to do this again. It's just too hard on him. And which is an incredibly difficult decision for a wife to make, that I would prefer not to see him or him not to see me over the hurt that it causes because of the confusion.
So how did you get this idea to make yourself a part of the life of the home to be able to see your husband?
I had originally asked at the very beginning, is there anything that I can do? Can I volunteer? I mean, there's got to be something. Can I get a job? What can I do? And they sort of said, let's just kind of see how this is going to work. I mean, at that point, obviously in March, we're thinking 30 days,
Yeah.
everything's going to be back to normal. Everything's going to be fine. And as time went on, I started getting a little bit more vocal, trying to contact the governor's office. The local news heard about it. And I am incredibly blessed that his facility, Rose Castle at Deerwood, also heard the stories. Their corporate office out of North Carolina called me completely out of the blue, actually 3 weeks ago today, and said, we understand that you might be interested in employment at our facility. And I said, yes, as a matter of fact, I am. And they said, well, we have a part-time job available if you'd like it. It's a dishwasher. And I said, I'll take it.
So what are your days like at the facility now and seeing your husband?
I go on Thursdays and Fridays, so I get to go tonight. I'm excited to go wash some dishes because I know what the reward is not the hourly rate, although I appreciate them actually paying me. The reward is after I will go in and work a couple hours. I will do the dinner dishes, get the kitchen really ready, mop the floors, clean the grill, take the garbage out. And then I get to go and spend a couple hours with him. And we have fallen right back into our routine. I have already seen a difference in the anxiety level of him knowing not only that I'm there right now, but that I'm coming back.
And I gather you're trying to help other people do this too.
I am. That's really the bigger purpose. I'm thrilled that I'm there, but I started a Facebook page called Caregivers for Compromise because isolation kills too. And the response has been enormous. We're at about 5,000 members right now. And we do believe there are ways that we can get to them. For example, outdoor visits, clean room visits with full PPE. We can be tested. I'm going to be tested today before I go in. I'm going to get a rapid test. I'm doing that just optionally every week just to be certain. The problem is we have isolated these people to save their lives, but the isolation is going to kill them. They need hugs. They need interaction. Brains without that wither and die. And not only do they die alone.
Yeah.
And we have to do better than this. We have to.
I have to say, Miss Daniel, you and Steve sound like loved ones indeed.
I promised him when he got his diagnosis that he would never be alone. I promised him so that he also knew he would never walk this road alone, that I would be there holding his hand every second of the way. And I have not been able to do that for 4 months. And there are thousands of people just like me who've made the same promise. And that's why we're going to continue to fight.
Mary Daniel of Jacksonville, Florida, thank you so much for being with us. And our best to Steve, our best to both of you.
I'm going to see him tonight. I'm very excited. I'm going to turn my phone off and I'm just going to lay in bed with him and watch a little TV. I can't wait.
And now.
So now, aging dishwasher or activist? So she is a resilient activist. She is indeed an aging dishwasher, a social media influencer. She has Facebook groups that have more than 1,000 members in a few different states. She's a promise keeper, a wife, a change maker, a caregiver, a creative problem solver, and so much more. Is she a duck or a bunny? Is she an aging dishwasher or so much more? Let me just look in the chat real quick. Okay. So I'm going to start by, like I mentioned earlier, talking about ageism. And I'm going to start by making a bold statement that we are all ageist. Even me, a clinical psychologist who works with older adults daily, a gerontologist, we are all ageist. So ageism is stereotyping and discrimination against individuals or groups based on their age. It can include prejudicial attitudes, discriminatory practices, or institutional policies and practices that perpetuate stereotypical beliefs. So it's a social disease fed by stereotypes, and it disproportionately affects older adults. So common ageist stereotypes are, oh, he's senile, he's having a senior moment, meaning he's becoming forgetful, sickly, unattractive, greedy, cantankerous, cranky, childlike, so we often infantilize older adults, perverted if they're sexually active. And so I'm curious what sort of ageist stereotypes come to mind when I start to list these. What sorts of ageist stereotypes come to mind? There are a lot. But are there some that you've heard more than others? Frail, not as sharp or as smart as in the past. Yeah. All older adults get dementia at some point. It's normal to be depressed, that everybody needs help. Fragile, bad drivers. That's a great one. Older adults are more likely to wear their seatbelt, drive the speed limit, and change their driving based on their own medical or physical changes. Slow, that they might engage in mansplaining, right? So maybe condescending, stubborn. Yeah, old dogs. You can't teach an old dog new tricks, which is also incorrect. Irrelevant, right? Invisible. Yeah, irrelevant meaning like what you have to say doesn't matter anymore. That's outdated. Rigid, great. Yes. So these are all stereotypes that we have about older adults. Thank you for your participation. So there are 3 types of ageism. The first is hostile ageism, and this is the most overt type of ageism. It shows up in the form of physical, financial, and verbal abuse. It's also implicated in the perception that older adults are a drain on society's resources. So there was a term that was popular and it was comical a few years ago called silver tsunami. And this is a term that was used to describe the baby boomer population flooding society like a tsunami. And so as you all might be aware, from 2011 to 2030, 10,000 people in the United States turn 65 every day. And so in 2034, I believe, there will be more people 65 and older than children under the age of 18. And so this term, silver tsunami, was created to kind of talk about this flood of older adults, silver hair, flooding society and depleting us of our resources. So it was comical, and it was also very ageist. This idea that older adults would deplete us, would harm us, would flood us, causing a catastrophe was very ageist. So we don't use the term silver tsunami anymore. The second type of ageism is neglectful ageism. And this is an ageism that overlooks the contributions of older adults and makes them invisible. So during the pandemic, I have had several friends who maybe were retired before the pandemic or retired during the pandemic, who then in retirement became the childcare for their grandchildren, because during the pandemic, a lot of the schools and daycare centers were closed, right? So I've known a lot of older adults, retired, who are providing childcare in my neighborhood, and my friends who have retired and are providing childcare for their grandchildren so their children can work. But we often will overlook the contributions that grandparents are making. And if we look at this from another angle, despite having the highest rates of suicide, older adults remain underdiagnosed and undertreated in mental health care. And that's due to this belief, one, that at a certain point, it's normal to be depressed, which is incorrect. And two, that older adults can't benefit from treatment, which is also incorrect. And we'll talk about that in a minute. So the third type of ageism is benevolent ageism. And this is a compassionate but paternalistic point of view, grouping older adults together as one uniformly frail and vulnerable population requiring protection. So during the pandemic, I was working at the Atlanta VA healthcare system. As I was driving to work at a satellite office, I couldn't work at home because I have a 3- and 5-year-old, and it was chaos. And so I would drive to a clinic, not at the medical center, because we were all asked to leave the medical center, which is where my office was for 10 years. And I was at a satellite office. And so I would drive on the freeway, and every day I drove under this sign, "Coronavirus, isolate the elderly." And I was driving to my clinic to treat older adults. But the "Coronavirus, isolate the elderly" sign was compassionate. we want to protect older adults from getting COVID, so make sure that we don't interact with them. However, it was so that was benevolent. However, it was incredibly harmful because, of course, all older adults are not alike. And if we isolate older adults, we have the potential of harming them. And this makes the assumption that all older adults are alike. And so they eventually changed the sign, not to my feedback. I had no idea who I would give that feedback to. But the sign changed to coronavirus, protect the vulnerable. And that was a sign I could get behind or drive underneath without bristling. All right, so here are some additional stereotypes perpetuated by the media. Older adults are portrayed as helpless victims. They defy negative stereotypes and are presented as bizarre and comical. Sometimes even I'll see, and I'll look at this fondly as well, but older adults dancing, right? And people will become sort of amazed that older adults can still dance. Growing old is equal to an inevitable, growing old is equal to inevitable deterioration and decline. So that frailty and vulnerability. And of course, we will deteriorate and decline, but it doesn't happen as soon as we turn 65. For some of us, it does. Maybe we have a medical vulnerability, but of course, it happens gradually. Older adults are demonized as a group. I don't want to be seen as a burden, or this term silver tsunami sort of demonizes them. They're going to deplete us of all of our resources. Take cover, the older adults are coming, the older adults are coming. And they're often underrepresented and ignored in the media, and also, I would say, in mental health and healthcare systems as well. So ageism is harmful, and this is where I am making a bold statement that ageism actually is another pandemic, because this is a global phenomena, that older adults disproportionately experience. So ageism is harmful and is linked to cardiovascular stress, lowered levels of self-efficacy. Self-efficacy means our belief in our ability to do something. So that includes self-confidence, and decreased productivity. So as a result of ageism, 60% of older adults do not receive recommended preventive services at their physician's office. So also, as a result of ageism, I've mentioned a couple of times this concept of depression going under-identified and untreated. There is this false belief that at a certain point in our life, as we age, we'll become depressed. And why wouldn't we? We're going to be dying soon. But I want you to know that depression is not a normal part of aging, and that depression actually is highly treatable in older adults. And so 1 in 5% of people 65 and older actually have depression. And those are people who are living like in their single family homes or apartments in the community. 13.5% of older adults who require home health assistance have depression, and 11.5% of older adults in the hospital have depression. We know also that depression rates are higher for older adults with chronic illness, which might be accounted for here in this home health care figure, and that also with medical problems have higher rates of depression. But still, you'll see it's not the majority. It's still less than 15% of older adults are living with depression. It is the most prevalent mental health condition among older adults. And here's the good news. Depression is highly treatable in older adults. So old dogs can learn new tricks. So 80% of the cases of depression in older adults are benefit from treatment. So treatment is effective. But depressive disorders, as I mentioned, are widely under-recognized and under-treated due to our false beliefs about aging. And so I'm glad that you're here and listening so that you get a little bit of a reminder that if you do suspect depression in an older adult you're working with, it might not be normal, or your own loved one, it might not be normal, and it can be treated. So what happens when depression does go untreated for older adults? So research shows that it can lead to greater impairments in physical, mental, and social functioning. It can affect the course of medical problems. It can increase visits to the doctor and the ER. Older adults who are depressed and the depression goes untreated use more medication for their medical problems and stay longer in the hospital for medical problems. All of this translates to greater expense, right? Financially, if you're going in the hospital so much and needing more medication and more trips to your doctor, a greater toll on the system, and then a difficulty for the family and caregivers as well. When, of course, depression is highly treatable, so we could treat the depression and help to reduce all of this fallout. And finally, ageism is deadly. So those with a positive view of aging live 7.5 years longer than those with a negative view of aging. And the thing that shapes our view about aging is ageism. So if we have a belief that all older adults will get depressed, get dementia, become frail and disabled and die and become a burden on society, and we internalize that, we're going to have a shorter lifespan. But we can shift that, and we're all working in senior care at some capacity. And so you can shift that as well and change a negative into a positive. So how can you do that? What can you do about ageism? You can develop awareness. So being here today is developing your awareness and just learning a little bit more about it. You can engage in perspective taking. Is it a duck or is it a bunny? Or is she a dishwasher or an activist, caregiver, change maker? You can shift your focus. So one idea about shifting focus is to shift how you interact with older adults. So for me, when I work in a medical system, I work with people sometimes with severe mental health conditions and significant medical conditions like ALS or spinal cord injuries or terminal cancer, all sorts of heavy stuff, right? And so I'm around people who are very medically ill and also might be struggling with mental illness as well. And so if that becomes my only perspective about how older adults are, right, or my only exposure to older adults, that's going to influence my perspective. And so what I have to do is tell myself, am I spending too much time with older adults who are in this stage of life? If so, I need to think about all the older adults in my community who are at a healthier place in their life and remind myself that all of these older adults exist, not just the ones that are medically ill and struggling with mental health conditions in the hospital. You can also shift your focus from a general idea of older adults to their unique qualities and attributes. Even people who are sick in the hospital have a contribution and unique attributes and qualities. And so even if I am working with an older adult who is at the stage of life that is more stereotypically an older adult, maybe in stage dementia, I can still look for their unique qualities and attributes. And I can shift my focus, and you can shift your focus from a stereotypical view of older adults to a counter stereotype. Is she a dishwasher? Is it a duck? Or is it a bunny? Is she a dishwasher or an activist? So I'm going to challenge you to think of an older adult, or maybe several, or maybe yourself, who you know is thriving in your community. My 72-year-old mom and mother-in-law runs marathons. Important to remember, older adults have the knowledge and skills from their life experience. So ask them about their resume and ask about ask about family and friends. We can all learn from older adults. Yes. But I'm going to ask you to think about your 80-year-old mom who rides her horse weekly. Oh my God, my hips would kill me, and I'm not even 50 yet. So think of an older adult you know who is thriving, right? So if we only look at the man with dementia in this community, we might not see the caregiver, right? who also is approaching older adulthood. So Miss Katie was a professional ballroom dancer, and she just turned 99 and led a dance competition at our community. Wonderful, thank you. So think of older adults who are thriving. Counter the stereotype. My 86-year-old mom and mother-in-law does yoga on Zoom right now, and she volunteers and is in a book club and lives independently. I used to manage a gym, and our oldest member was 92, and she would come in and work out with a personal trainer every other day, and she would never complain and was always very lovely to talk to. Wonderful. Thank you. So keep these counter stereotypes in mind. All right, 2, older adults and COVID. So here's where the second pandemic, so ageism being the first, COVID-19 being the second, disproportionately affects older adults. So as we get older, as you all are well aware during COVID, our risk of being hospitalized for COVID-19 increases exponentially. So this was a snapshot of from June. There is new data, and actually it still looks like this. It's on the CDC website. It's very similar. Of course, the numbers are greater now because there are more deaths and more hospitalizations. In addition to increased risk for hospitalization, 8 out of 10 COVID deaths in the US have been adults 65 years old and older. So we know that COVID is disproportionately affecting older adults physically. And that has been incredibly painful for all of us working in senior care, and especially folks in assisted living or who have lost our own family members. So my heart goes out to you, and especially folks in assisted living, and just all that you have done to maintain your communities and connect with families and help your residents connect with their families and maintain a sense of community, and then staff feeling overworked and under-resourced. I applaud you. So thank you for all the work that you're doing. So there's a toll, and one thing that we didn't talk about yet was also around ageism and dementia. But of course, the toll of COVID on older adults with dementia has been significant as well. And as Mary, the woman in the
Hello?
audio, yes?
Hey, Popo.
Oh.
Yeah, I'm gonna jump off.
And so I can't see anybody, so I was thinking, oh no, did I miss something? So for older adults with dementia, we know that COVID has disproportionately affected these families, and it's been incredibly challenging. One, because with dementia disorders, our tone of voice and articulating sound and touch can be incredibly soothing for folks with dementia, but then we have to wear masks, and so we can't use our tone of voice as well because it gets muffled by the mask. And folks with dementia can't see our facial expressions as well because the mask, and then if we wear glasses and we're all hidden, it can be very upsetting. And we have seen decline in dementia with older adults during COVID. I am, in this presentation, going to focus on older adults without dementia. And so for older adults without dementia, there have the recommendations for social distancing for COVID-19 safety increases the risk for social isolation, which we're very concerned about with older adults, because we know that social isolation increases the risk for depression and anxiety. And so that's been a real concern of ours. Will older adults who are maintaining physical distance become isolated? And then will that isolation lead to depression and anxiety? That's very scary for us. And then with prolonged uncertainty and worry, there's an increased risk for depression and anxiety as well. And so we know also that depression and anxiety increase the risk for suicidal thoughts and make medical problems worse. So we have had a lot of anxiety as a society about what the social distancing and this uncertainty and worry, and all of peers and loved ones in our age group, if we're older adults, being more likely to die. We're worried about the toll that this is taking on older adults emotionally. And we've also seen that there is a significant toll of the COVID-19 pandemic on caregivers. And so close to 33% of caregivers are reporting mental health problems like anxiety, depression, or substance use, compared to 6.3% of non-caregivers. And a little more than 30% of caregivers of older adults thought about suicide, much higher than other high-risk groups. Other high-risk groups being healthcare providers, frontline providers, and Latinx folks and African American folks. For this COVID-19 pandemic in general, we can talk about racial differences at another time. In general, white folks tend to have higher rates of suicide. So how is the pandemic? Actually, so we've had all of these concerns, right, about older adults, caregivers aside. How is the pandemic affecting the mental health of older adults? So a CDC survey of 5,000 older adults found that older adults are actually faring the best in terms of depression, anxiety, and trauma and stress related disorders. And the group that's faring the worst, sadly, are 18 to 24-year-old adults. And you'll see there's a high rate of depression, anxiety, and trauma and stress related disorder. You'll also notice the trend that as we get older, our rates for depression, anxiety, and trauma and stress related disorder drop. So this is good news for older adults. This is bad news for 18 to 24-year-olds. And this is not just a phenomenon in the United States. This is true in Spain and Canada and the Netherlands. So studies have come out in Spain and Canada and the Netherlands showing that older adults tend to be really good at coping. Okay, now what about older adults with pre-existing depression and anxiety? So say you were an older adult and you had depression, anxiety before COVID, and now it's COVID and you're more socially isolated and withdrawn. So studies looked at this, studies across 5 major universities and big ones like UCLA and University in Pittsburgh and University of Toronto and other big university in St. Louis with medical centers, all looked at this as well. And they found that the rates of depression, anxiety, and suicidal ideation for older adults who had pre-existing depression, anxiety, and were in treatment did not differ from scores before the pandemic. They were, however, more concerned about the risk of contracting the virus. They were worried that their mental health would suffer from continued physical distancing, and they were outraged by the inadequate government response to the pandemic. So those were their more pressing concerns. What will happen to us in the future, but we're able to maintain? One of the study researchers was quoted as saying, "We thought that these older adults would be more vulnerable to the stress of COVID because they are, by CDC definition, the most vulnerable population. But what we learned," and that I'm guessing is around physical vulnerability, but what we learned is that older adults with depression can be resilient. They told us that coping with chronic depression taught them to be resilient. She went on to say that perhaps we could learn from them about what they're doing to maintain resilience. And this leads me to another term called crisis competence. So there's a crisis competence. As we get older, we get the sense that we're going to be able to handle it because we've been able to handle challenges in the past. You know, you get past it. These things happen, but there's an end to it, and there's a life after that. And that was a quote in the New York Times from Dr. Mark Brennan-Ing, who's a senior research scientist at Hunter College, coining the term crisis competence. So older adults have crisis competence and resilience, and they're demonstrating that at significant levels during COVID-19. So even though older adults are physically vulnerable to the COVID-19 virus, they are emotionally the most resilient to the pandemic as well. And that is the fuller picture. Duck or bunny? So resilience is the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress, like family and relationship problems, losses like death, life-altering health problems, disasters like COVID-19. So now I'm going to list what five resilient strategies that research has shown older adults using during the pandemic. The first, older adults are tending to focus on quality, not quantity, in their relationships. For older adults experiencing isolation, like being more physically distant, having close or meaningful relationships was more protective than having more interactions with others. So older adults are also tapping into wisdom, particularly compassion. So wisdom, researchers, I kind of define wisdom as having lots of factors, including like emotion regulation, trying to think of others. High threshold tolerance for sadness, ability to grieve, problem solving. And one of them that they looked at specifically was compassion. And so compassion is the most strongly and inversely correlated with loneliness. So the more compassion you have for yourself and others, the less loneliness you tend to experience. So older adults have been shown to be tapping more into their compassion and reducing their loneliness, and that this actually promotes greater well-being as well. So the other relevant feature about compassion in older adults is that older adults, when studied related to wisdom and compassion, older adults tend to have more compassion than younger adults. And so it's easier to access. And so this year, actually, one of my goals is to pursue more self-compassion. I'm a very ambitious person. I like to, I write a lot. I like to publish a lot. I like to do a lot of things. And during this past year, I haven't been able to do as much because I don't have as much childcare because of COVID. And I have a 3 and 5-year-old. And so I'm in the process of trying to grow and learn by using self-compassion. Thanks to older adults, I'm doing this more. So, and 3 is to practice mindfulness and stay in the moment. And so meditation and mindfulness have been shown to help slow memory loss and the development of dementia, and help people to cope better with anxiety and stress and reduce loneliness. And research was showing that older adults who are doing well during the pandemic are also practicing mindfulness and staying in the present moment rather than think too much about what the future holds for them. They're also maintaining regular schedules, including hobbies, work, exercise, and chores. And this is really important because routines provide a sense of security and predictability and help to reduce stress and anxiety, and have the added benefit of helping us sleep better at night. And sleeping better at night helps our mood, which helps with all these other things. And older adults are also accessing mental health care and support when needed. And so they don't necessarily always, it doesn't have to be formal mental health care. It can be support in the form of like I have a pretty integrated community in terms of age and race and gender. And a lot of the recent retirees in our neighborhood will have a happy hour in somebody's driveway every Friday night. And so there's support there. So mental health care and support groups when you need them are essential for wellness and resilience. And we saw that with the folks in the depression study, it was actually depression, anxiety, and suicidal thoughts study with those 5 universities, that they were engaged in treatment, and that the researchers thought that the skills that they were learning in treatment were helping them to maintain resilience and cope during the pandemic as well. So just to review the 5 resilient strategies. So 1 is to focus on quality, not quantity in relationships, tap into wisdom, particularly compassion, to practice mindfulness, maintain regular schedules, including hobbies, chores, exercise, and so on, access mental health care and support when you need to. If you want a refresher of all of this, I have a podcast just on this, and you can just listen to it wherever you listen to podcast episodes. And it's free. So which strategy have you used over the past year? I just want to check in and see, which strategy have you used? Any thoughts? How have you coped? 1, 2, 3, and 4. Wow, Rebecca, you're a champion. No, we haven't sought out any support, even informal friend groups. Quality of relationships via Zoom meetings with grandkids. Oh, maybe Rebecca has a number 5 in there as well. She swept the board. Keeping a schedule, compassion, Zooming with kids and friends, and accessing support when needed. I lead a support group for caregivers, wonderful, of Alzheimer's disease and patients once a month, and welcome all attendees via Zoom. Wonderful. All right. Walking the parents' farm with them. Wow, that's really cool. A farm. Staying thankful. Yeah, practicing gratitude. I'm doing that too now this year. That's wonderful. All right, so which resilience strategy will you start using this year? So somebody else said last year, I think, had access support group communities and write to friends and kept busy. Limited roller skating to an adult night with a smaller group. Created a vision board. Okay, so I'm going to switch gears and ask you which strategy you will start using this year. Better schedule, including sleep habits. Yes, I need that too. To start focusing on quality in your relationships. Thanks, Benita. That is always a noble goal. More exercise, self-care. Wonderful. Oops. Great. Practicing mindfulness. Schedule and compassion and exercise. Cool. Deep breathing exercises to reduce stress. I love it. Okay. All right. So now I'm going to talk a little bit about how we could work together if you're interested. So as John mentioned, I work with professionals. I typically provide training programs and offer consultation and program development around the mental health care of older adults and their families. And if you're interested, you can contact me. I have a whole list on my website of trainings that I offer. But if you are not in the mood for that, you can get more tips on working with older adults and their families just by listening to the podcast and articles that I write. And that is all free. And so you could subscribe to the podcast wherever you listen to podcasts, like on Apple, Stitcher, Spotify. And the benefit of doing that is it helps people actually, so there are not many people like me talking about aging on podcasts, right? In like the popular media. And so if you subscribe and leave a review, it actually helps people who are looking for something like this to find the show. So just a shameless plug for subscribing and leaving a review. But really, if you want more tips, I interview professionals, national professionals on working with older adults. And then I also offer actionable tips like in our talk today. So now I told you, you've been waiting. Thanks for being here. How to get this bonus. So if you want this bonus, which is the 5 must-know facts when working with older adults, it's actually a myth buster. So I bust 5 myths and give lots of resources about working with older adults. If you want this, head on over to my website. That's drreginakoepp.com//facts. And you can get access to this guide. And then at the beginning of COVID-19, I created a COVID-19 wellness guide for older adults, and it's had more than 1,000 downloads and been on Georgia Tech had it on their site for a while, and Emory HR had it on their site for a while. But it's designed just with older adults in mind and gives lots of resources as well. And so you can grab that guide if you want as well. And these are all free. And you could just go to my website, the COVID Wellness. So drreginakoepp.com/COVID Wellness. And that's it. So I'm so curious to see in this chat box what people were talking about earlier. I know we have to wrap up, but I wanted to see if there were any questions, or I don't know how you all moderate questions. Yes, I can put up the last slide with the contact info.
I was going to ask Brian to unmute because I was unable to unmute myself. Dr. Koepp, I really appreciate what you provided. And there were several. I actually went on your website and I think I just all I had to do was go on there and just basically subscribe. But I don't know, are there several specific things we need to do to be able to get, like, for example, access the podcast, access the resources? Your link had a slash, fax or slash something. Do
Yes,
we need to
so
do each of those things, or what? How does that work?
Yes. So, well, or you could just email me. Thanks, Melissa. You could just email me and I'll send them to you. But to get them just directly in your email, it also will sign you up for a weekly email where I'll send you my podcast. If you don't want that, you can always unsubscribe. And then it helps people to find the show if you subscribe on an iTunes or a Stitcher or Spotify. If you subscribe on my website, it signs you up for a weekly email where you get notified of the podcast.
Okay.
And this week's podcast is on helping older adults with mental illness find senior living.
So I got to get somebody that's younger than I am to tell me how to subscribe to your podcast, because I'm too old to know how to do that.
Oh, well, or you don't have to if you're not going to go there. It's not that big of a deal. But the most important is that you're just a purveyor. You're receiving and sharing information that's dispelling.
I want to point out that John was just being ageist.
Thank you, John. What do you have to say for yourself?
I am actually old, so I'm not being ageist.
Do I need to start
real.
over? Oh, no. Well, actually, older adults tend to be the most ageist because they've had a lifetime of internalizing ageism.
Well, that hurts my feelings if you said that. So
I have a question.
Dawn, you aren't old until someone puts a marker on top of you, and then you're old because you can't be anymore. So
I see.
Remember that.
Thank you.
I think
All right,
Paula was saying.
Yeah, hi, Regina. So with all the experts in the country knowing about what's happening with isolation, I would think that after 6 months into the pandemic, we would have known how important touch is and, all those things. They have had their family members wear the PPE, go outside, even do backward hugs, anything to have the touch. It's very frustrating that didn't happen.
Oh, well, Paula, first, I think you're so right. I don't know. I wish I had all the answers for this, but I don't. One is I've known lots of assisted living and memory care communities have a different role open for family visits and outside visits, courtyard visits. I was seeing my patients, many who lived in memory care, in a courtyard with their family member with full PPE. Every state has their guidelines, then the CDC, and then every assisted living community has also their guidelines, and people don't want to be have a grievance and then flagged. And then I've also had COVID communities. I had a patient who had to flee from Louisiana, because his assisted living community, 60 people died from COVID, and he had to flee, and it was all over the news. And it was horrible. But so, and I think at stages, I think it's an impossible position, honestly, for assisted living and memory care to be in, because you have the community that you also have to hold. You can't. And then if one well-meaning family, and so it's like risk mitigation. Where's the least amount of risk? Is the least amount of risk then what we know will kill people immediately is COVID in our community, that we're going to go with that. It's horrible, and it's impossible decisions. Nothing is going to feel good. It's going to feel, and staff don't feel good about it. Staff know it's harming people, and staff then are overworked, under-resourced, burned out, grieving their own losses, dying more, putting themselves at risk. And I mean, it's been an impossible position for everybody. But I also agree with you. My heart has been broken around the touch, and I am a very tactile when I'm working, especially with dementia. I'm a very or somebody who's hard of hearing. And I'm doing family therapy, I'll touch the person, right? To say, bring your attention back to me, because touch is so influential. But it's just been impossible. And this is one of the frustrations, I think, for the older adults in that study. You'll remember that they've been just appalled at the handling of the pandemic as well. And so I think that that's part of it, that there hasn't been great leadership around how to navigate this, especially in assisted living and long-term care communities. And states have their rules, and CDC has its rules. And I mean, I just think assisted living and memory care are in impossible positions. I have known, especially for families and even independent living, my independent living patients will tell me, I am incarcerated for a crime I didn't commit, and I'm going to do it anyway because I want to protect my community and myself. I don't want to put myself at risk. And then they're not seeing their girlfriend who lives down the hall, or, I mean, it's been so painful for everybody. Or then they pod a little bit. But I feel grateful for my community because the older adults in my community are podding a bit. And a neighbor of mine turned 95 during COVID, and we had an outdoor party for her. She lives independently and walks every day. So, and they were inviting my kids to come close. My kids are 3 and 5. I was like, no way, my kids will not be near you. But we'll celebrate from at the end of the block. So, I mean, you're right. You know, it just speaks to the heartbreak of the whole pandemic and the constant dilemmas that people are in. And you're right about touch. It's essential. It's an essential bonding, and oxytocin is essential for the brain too. And I have no good answer, because I think there is no good answer, honestly. There's no answer that's going to make us feel good about this, because it's just been awful. But
Thank you.
Thank you again, Regina, so much. It's been very helpful.